Well, actually, I think one of the issues that boards ought to focus on is really their capability to improve and change, and that's not an issue that's been that's really nascent in its discussions at board levels. There's a concept that comes from I first heard it when talking about the Malcolm Baldrige Quality Awards. We call it agility, and organizational agility. Can you adapt to the changes? So I think that's one of the areas that there's not been enough conversation at the board level about how they're going to build the agility to adapt to the kind of the changes that are going on around. I think what's going to happen in boards is that the conversations have to move from operations to be much more strategic. How do we become more agile? How do we create more value? How do we get the cost down? There's a conversation that's going to start in boardrooms soon, and another one, about what does it actually cost to do if somebody comes for an MRI, or somebody comes for a colonoscopy, or somebody comes for an outpatient procedure, or come to the ED, what's it going to cost? And that question has been really historically, it's really a question about price here. All right. Now, that's a historical question. We've said, well, it hadn't mattered very much because nobody pays the price. Well, if you notice that one of the trends, one of the mega trends in healthcare right now is moving to much higher deductibles. As we increase the number of people insured, a lot of these plans have much higher deductibles. All of a sudden, price becomes important. If you got a $6,000 deductible, it becomes important that that the colonoscopy is $800 as opposed to $3,000, and that's a conversation that's just beginning to happen in boardrooms as things hit the newspaper and et cetera. So it's going to be very interesting over the next 4 or 5 years to be part of these conversations.